my name is Fabricio Briones. I'm a registered nurse. I am going to perform an examination on my daughter, Natasha. I'm going to examine her head, ears, nose, throat, respiration, and cardiac assessment. The first thing I'm going to see is her appearance. Her appearance is normal, no abnormalities noted. Second, I'm going to see her head. I'm going to inspect her head. Her head is symmetrical. Then I am going to palpate her scalp, and I feel no lesions, no masses. Her hair distribution is normal. Then I'm going to assess her TMJ. Please open your mouth and close your mouth. If there was any clicking, that would be a positive TMJ. Then I am going to assess her eyes. Upon inspection, they're symmetrical. There's no drainage noted. Her sclera is clear. Her conjunctiva is nice and pink. Now I'm going to test her pupil reaction. Her pupil reaction is normal bilaterally. Now I am going to assess her red reflex with the otoscope. Okay. Red reflex is present bilaterally. Now I'm going to assess her retina, vessels, macula, and optic disc. Okay. Okay. So her optic disc is sharp, edges not blurred. There's no blood vessels around the macula. Your ears. First, I'm going to inspect them. They look symmetrical. There's no deformities. There's no drainage noted. Then I'm going to use the otoscope, and I'm going to check her ears, her tympanic membranes. I have to pull her ear back and up. And her tympanic membranes are pearl and gray. There's no fluids noted. The same thing I'm going to do with the other ear. I am going to pull back her and up her ear. I'm going to check her tympanic membranes. They are pearly and gray. No fluids, no drainage noted. Now I'm going to assess her nose. Please turn around. Okay, first, upon inspection of the nose, I see that her nose is symmetrical. There's no deformities. There's no deviation. There's no lesions noted. There's no drainage as well. Then I'm going to use my otoscope, and I'm going to see inside her nostrils. Okay, they are nice and pink. There's no drainage noted. No deformities. The other side. Nice and pink. There is no deformities, no drainage noted. I'm going to assess her mouth. First, I inspect her lips. Her lips have no lesions noted. Can you please smile? Her teeth they're perfect. There's nothing wrong with them. Can you please raise your lips? Her gums are nice and pink. No lesions noted. Now, can you please open your mouth? I'm going to inspect her tongue, and I'm going to see her tonsils. Her tongue is pink. Her tonsils are grade 1. There's no swelling. There's no redness or irritation noted. Now I am going to assess her neck. All right, her neck looks symmetrical, both sides. I am going to assess her carotid pulse, one at a time, because I don't want the patient to pass out. Now I'm going to do it on the other side. Okay. I feel them. They're nice and steady and all right. Now I'm going to inspect her jugular vein distension. Please tilt your head back. Okay, there's no jugular vein distension noted bilaterally. Now, can you please turn around to face the camera? I am going to palpate for her thyroid. I don't feel no masses. Also, I am going to auscultate her carotid artery. There's no bruits noted, no thrills. No bruits, no thrills. And swallow, please. Okay, no swallowing abnormalities noted. I'm going to perform a respiratory assessment. Okay, the first thing I am going to do, I am going to ask her to turn around so I could check for her lungs, her posterior aspect of her lungs. All right, the first thing I'm going to do is I am going to tell her to say the word 99. I am going to feel for vibration.
99, 99, 99, 99.
Okay, there's no vibrations noted. I mean, there's no dullness. If vibrations are equal, no dullness noted. Now I am going to percuss her lungs. Okay, no dullness noted. Now I'm going to use my stethoscope and I am going to do the bronchophony. Okay, I'm going to tell you to say the word 99 while I listen to your lungs.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, the results are normal. No dullness noted. Now I am going to ask her to turn around so I could do the front, her anterior part of her lungs. Okay. All right, upon that inspection, I see that her back is normal. There's nothing, there's no abnormalities noted. Okay. I am going to, first I am going to tell her to say 99 and I'm going to feel for vibrations.
99, 99, 99.
Okay. Now I am going to percuss her anterior chest.
99.
No, I don't see 99. Okay, so there is no dullness needed, noted. Now I am going to listen to her lungs, what she says, 99.
99, 99, 99, 99.
While I am here, I am going to listen to her lung sounds. Okay, I forgot to listen to her lung sounds in the back, and now I'm going to listen to her lung sounds in the back. Take a deep breath. One last time. Last time. Perfect. Her lung sounds are clear upon auscultation. Now, please. Now I am going to do the circulatory assessment. Okay. First, I am going to listen to her heart. I am going to listen with the belt of my stethoscope. I am going to listen to the aortic valve. Then I am going to listen to the pulmonic valve. Now Herb's point, the tricuspid, and the mitral. Okay, now I'm going to switch it with the diaphragm. Pulmonic valve, Herb's point, tricuspid, and mitral. Okay, I only heard S1 and S2 sounds. There was no S3 or S4, and no murmurs heard.